Welcome to your first session. Most people can think of several things that make their asthma worse. These are known as triggers, and a variety of triggers can contribute to your asthma, including allergens, viral infections, pollutants, and drugs. A trigger is anything that irritates the airways and causes the symptoms of asthma to appear. Everyone's asthma is different, and you will probably have several triggers. It can be difficult to identify exactly what triggers your asthma, as the effects can take up to 4 to 6 hours before you notice them, or even longer. Reducing your exposure to some of these risk factors improves your control of asthma and reduces the need for drugs. For example, you can avoid tobacco smoke or foods and additives known to cause symptoms of asthma. In the case of other known triggers, allergens, viral infections, and pollutants, measures should be taken to avoid these as far as possible. Many people react to multiple factors that are common in the environment. However, avoiding these factors is usually impractical and very limiting for people with asthma and allergies. Therefore, medications to maintain asthma control have an important role because a person is often less sensitive to the risk factors when their asthma is under proper control. Often it's not just one trigger that sets off an episode of asthma, but a mixture of several triggers at about the same time. Triggers in the air include not only car exhaust fumes, but also cigarette smoke, fly sprays, strong perfumes, and aerosol cleaning sprays. Some building materials and home furnishings may also give off fumes that might make asthma worse. The common triggers are air pollutants, allergies, cigarette smoking, colds and flu, certain drugs, emotions, exercise, some food and drink, certain occupations, and weather conditions. When it comes to air pollutants, you need to try to find what the trigger is. You need to keep well informed about air quality if pollution triggers your asthma. You may need to avoid being outdoors, especially in the afternoon, if you feel that this may be a trigger for you. You should ensure that your home is well ventilated so that the fumes do not accumulate, and get heating systems serviced regularly. The most common causes of allergies are house dust mites, pets, pollens, molds, and fungal spores. Avoidance of passive and active smoking is the most important measure for adults because at least 75% of people with asthma become wheezy in a smoky room. Also, colds and flu, along with throat and nose infections, can bring on asthma episodes. The first signs are usually a blocked or runny nose or a sore throat. You may want to ask your doctor about getting your flu jab each year. Also, aspirin and other non-steroidal anti-inflammatory drugs can cause severe asthma attacks and should be avoided if you have a history of reacting to these agents. They have been known to cause severe attacks in up to 28% of adults. The major triggers of asthma at work include chemicals found in spray paint, foam moulding, and adhesives. Dust from flour and grain. Wood dust, particularly hardwood and red cedar wood dust. Fumes found in glues, soldering, and floor cleaners. Dust from insects, animals, and their waste products. Latex, stress, and tobacco smoke. Occupational asthma can sometimes take weeks, months, or years to develop. If you notice anything that makes your asthma worse, discuss it with your doctor. Taking action to reduce these triggers is vital. Thank you for your participation so far, and see you at the next video.